Pathways to Nursing, Nursing Perspectives 3110. This is a quick 5-minute synopsis of pathways to nursing education. The existence of multiple pathways contributes to a very confusing landscape of nursing education that creates challenges for aspiring nurses as they try to choose the most appropriate type of program in which to enter the profession. No matter which type of entry into practice program one chooses, the demands placed on nursing in the emergent healthcare system are likely to require a greater portion of registered nurses who are prepared beyond that of the associate degree or diploma degree. The nursing education system is challenged to balance the goal of providing adequate numbers of baccalaureate-prepared nurses while simultaneously advancing the education level of nurses prepared at the associate degree or diploma level. It's been about 40 years since the ANA published its first position paper on the entry into practice, advocating for a bachelor's degree. The state of North Dakota was successful at getting the entry into practice fully implemented. However, it was rescinded in 2003. Currently, we're seeing some changes. It used to be hospitals in Boston, the major ones, would not accept nurses unless they had a bachelor's degree. This isn't a new phenomenon. This actually happened when I was in school back in the 1980s. Beth Israel, the only way you could work there is if you had a bachelor's degree. This is slowly changing. For example, Boston Medical, where I work, we're actually hiring associate degree nurses with the stipulation that they go back to school and acquire their bachelor's degree. One of the reasons the institution is doing that is, it basically relates to cultural competence. We want patients who are diverse to have nurses with diverse backgrounds to take care of them and so forth. Also, when I was in school, and ask maybe your mother or your aunts and so forth, typically people went to diploma schools. And when people graduated, they became what we referred to as graduate nurses. So when I first started working at Boston City, I was considered a graduate nurse. And I worked with nurses who had their bachelor's degree. And for the nurses who had their bachelor's degree, they actually had a different type of an orientation program. Unfortunately, what was happening, the nurses who were actually passing their licensing boards were actually diploma nurses because it was very focused towards passing your boards and it was clinical focused. So people were very, readily, they could take care of patients very quickly, where sometimes the bachelor's nurse struggled. And obviously this doesn't apply to everybody because everybody's different, but just kind of an interesting phenomenon. And once again, we're starting to see things change. So the Institute of Medicine, and I think this is a great report to read for those of you who are looking for some position statements, look at the future of nursing and their recommendations for the focus on education. You might get some ideas from this. So healthcare system needs to provide safe, quality, patient-centered, accessible, and affordable care. Nursing education must be fundamentally improved both before and after nurses receive their license. And we see this all the time, especially nurses who go on and get their certification. You have to keep up your CEUs. Even yourself, right? You're required to get so many CEUs every 2 years. What we know is there's a need for highly educated nurses. We know that the population is aging. We see more chronic diseases and its complexities. So basically, patients' needs and care environments are becoming more complex, and nurses need to deliver this high-quality patient care. We actually saw this, right, with our NCLEX. Our NCLEX tests are considered to be significantly higher than what they were, say, 5-6 years ago. And it's for this very reason this has happened, because our patients are sicker and the environments are more complex. We needed to have an NCLEX test that actually reflected that. So the Institute of Medicine, it talks about improved education system. We want to see an increased percentage of nurses with the BSN, higher levels of education at the master's and doctorate levels, nurses with their baccalaureate degree to be increased to 80% by the year 2020. Diploma programs, and once again I had mentioned this, talk to your mom or maybe your aunts and so forth. Diploma schools are where people actually got most of their nursing training. It was considered to be the first formal nursing education in the U.S. The programs lasted anywhere from 4 months to 3 years. I, for example, went to a 3-year program. I also, at that time, earned some degrees towards my bachelor's. Peak 1958, there were approximately 944 programs. 86% of the working force were diploma graduates. By 1993, it was down to 126. By 2010, it was down to 54 programs. And I'm trying to think of like the programs that I know that exist around here. The only one I could possibly think of is the Brockton School of Nursing, which still exists and so forth. And realistically, they must be struggling. There's a picture of me when I was a diploma grad, when I graduated and so forth. And I graduated when I was about 20 years old. Diploma schools, for me, it was great because I went right out of high school. I had no experience. I didn't work as a CNA. And once again, diploma schools were very clinically focused. Just to let you know, notice though the nice crisp white uniform, that was your graduation uniform. Also for your pinning, notice I'm wearing my pin. Each pin is unique to its institution. And the black stripe, which is a cap, on the cap actually signifies that it's a senior nursing student. And for the first 2 years, you actually wore, obviously, no stripe. So the baccalaureate degree used to be up to 5 years. It was popular in the 1950s, but it was very slow to catch on. The focus was on public health nursing. The focus was also to be more of a generalist. BSN programs are still growing today. In 2004, there were approximately 274. In just 4 years, that number's up to 748 programs. Accelerated BSN programs, right? This was a result of the nursing shortage. We wanted to get people through school quicker. Some programs accept non-nursing college graduates, and the curriculum is designed for completion in less time than the traditional BSN. So it was kind of thought of as a bridge, and a lot of classes were considered transition classes to get people through. Mass General had one of these programs where they actually would take people with other degrees, other bachelor's degrees, and they would basically turn them over, flip them over into being, nurses with their master's degree pretty quickly. RN to BSN track admitted both pre-licensure students and RNs. Some RNs who were graduates of diplomas or associate degree programs. And then some programs were only admitted, to do the RN track and so forth, right? This was typical at the UMass program. Its design is to recognize and reward prior learning, right? Vocational education is referred to as your LPN. It started in 1942 in response to a nursing shortage. Typically, the length of time was anywhere from 9 to 15 months in length. Obviously, the problems today, patients are more complex today, and LPNs are considered not to be able to take care of those patients. Not me personally, this is just what the literature is saying, right? And courses do not typically transfer well with the LPN education and so forth, right? And remember, once again, right, patients are becoming more complex, the environment is more complex, and we need nurses to meet those demands. When I worked at Boston Medical, when I first started back in the 80s, we actually had a lot of LPNs. LPNs working right at the bedside. Today, what I actually see is the institution is probably down to about 2 LPNs, and they work in the clinic. So a big shift. We also had something referred to as senior LPNs, and these LPNs worked in the ICU, and they were able to give IV medications and so forth, and this was actually unique to the institution. Associate degrees. 1952, it was designed by Mildred Montag and intended to be a collegiate alternative for the preparation of technical nurses. So basically, a little bit more advanced, we're going to give them more knowledge, right? And once again, it was in response to the nursing shortage. The idea was they would care for the patients at the bedside in primarily secondary settings, your rehab facilities and so forth. Master's degree, Started actually probably in around 1899. The focus was on nursing management and nursing education. And when people were actually going back to school in the 1990s or before that, those were the two tracks that were probably the most common. And even for myself, I actually started in the nursing education track, but I had a very good advisor who knew my background, where I had such a strength in critical care and I had worked in all the ICU. She was the one who said, you know, Joe, I think you need to get your degree as a clinical nurse specialist in critical care. She said, if you ever want to go into nursing education, they're going to take you with that background. So you don't want to sell yourself short and just limit yourself to nursing education. You want to do something a little bit more advanced. And trust me, if you want to do the educational piece, you'll be all set. It was probably one of the best pieces of advice I ever got. And obviously the tracks are different now. You don't see as many people going into the clinical nurse specialist. But I think the big trend right now is everybody wants to get their NPs. But what happens when everybody wants to get their NPs? It becomes inundated, it becomes flooded, and so forth. The field and so forth. But it's changing. You know, there's a, when people went back for their, say, master's as a nurse practitioner, right? It was geriatrics, it was primary care. Now there's a whole multitude of specialties. You know, I love the concept of people getting their nurse practitioners and doing palliative care, which I think is just an up and coming field. But anyhow, getting back to the master's degree, between 1950 and 1960, it actually escalated and it became more visible. By 1990s, it was the advanced practice nurse, and once again, that was considered, the big two tracks were your your nurse practitioners and your clinical nurse specialist. Once again, clinical nurse specialist and your nurse practitioners, those were the two big ones. By 1973, you had about 86 programs, and by 2008, you had 475 programs. And I'm sure that's actually increasing even more today. And probably the reason for it is, look at how many online educational programs there are. Sometimes around 6 o'clock every night, there must be about 3 or 4 commercials, advocating for, different master's programs of nursing, SNU, etc., Northeastern University. It's probably the way of the future, and we'll talk about that in a minute. So RN to master's, bachelor's of science degree or its equivalent, is usually a requirement for admission to a master's program. There's about 158 programs. Mass General Hospital, once again, I had mentioned to you, they had this program where basically if you had a bachelor's degree in something else, you could be almost fast-tracked and end up with your master's and so forth. Dual degree programs, some people actually went and they got their MS and their MBAs at the same time. Just a little piece of advice while we're here chatting. A lot of people don't know this, but in order to teach, like if you wanted to take my job, which someday you will, because I'll be retiring soon, you actually need to have your master's in nursing. A lot of my colleagues who went back to school actually got their degree in, health administration. But with a health administration degree, you cannot teach the theory component of class. Just a little interesting tidbit, and I think if you don't know about it, it's a good thing to know. Your doctoral degree, this is considered the end degree. This is what they refer to as your terminal degree. After this, there is no more. Unless you want to do a postdoc, and that's a whole different thing. But your doctoral degree, once again, typically it's your end degree. And it's either considered to be research focused, and once again, these are your people with your PhDs. And then there's practice focus. Practice focus, I think of as your DNP. Obviously, there's some overlap because I know a lot of DNPs who actually do original research, etc. So you're not limited. But I think of sometimes, for example, the practice focused person. No, for example, myself, I still work at the bedside. I've been working at the bedside for 30-something years, right? The DNP was probably a better fit for me, right? I love the DNP. I love patient outcomes. I love working at a healthcare facility and implementing quality improvements and implementing all these different projects that ultimately can affect patient outcomes, right? Your research focus, once again, your PhDs. Sometimes these people, they like to do original research. They're like, you know what? I want to study this and maybe apply this type of a framework to this and so forth. So they're both very different, but they can be similar. And you just have to decide which one works for you. One of the best pieces of advice I ever got was, look at your programs, look at the type of classes that each one offers, and which one really appeals to you. So what are you really interested? I think sometimes with, the D&P, I loved, taking epidemiology and evidence-based practice, right? Everything we do today at the bedside, right? Or nursing, right? It's evidence-based. What is the research showing us? So once again, that was the perfect fit for me. So when you're looking for programs of, schooling and so forth, you have to look at a whole bunch of things. Cost is very important, right? I'm always amazed at people, and I tell people this, if you have somebody who can pay your way, or you can get a scholarship and so forth, good for you. If you have $50,000, $60,000 a year laying around and you can pick whatever school you want to, once again, good for you. A lot of the people I know, they're supporting families. People are going back to school. So my take-home message is cost is important. You also have to look at quality and accreditation. Listen, the bottom line is you need to go to a school that's accredited. If you don't, your degree runs the chance of not being recognized when you graduate. So once again, accreditation is very important. And look at what the accrediting bodies are. Accessibility. I always tell people you have to do what works for you, right? Things are a little bit different now. We have this whole entourage of online learning. And for me personally, I think that's the way of the future. For me personally too, having been an older person going back to school, working on my doctorate, online was in some ways, I guess, a little bit intimidating, but probably the best thing I ever did. Online learning and education too, you think you can't build relationships with people, but you can. I feel very connected to my committee chairperson and some of my colleagues that have been in my little cohort and so forth. Traditional classes, I think you all have been in traditional classes. This is the typical, you come to class, the professor lectures every week. Hybrid, this is what you're doing now. You're in a hybrid class. It's kind of like in some ways the best of both worlds. So you come in for a couple of classes, and because this is your first nursing class, we have you come in typically 3 times, but eventually that'll go down to 2, right? You'll see the professor at the beginning, and you'll see them at the end and so forth typically. And once again, online. And my personal bias is I think online is the way of the future and so forth. Remember, a lot of people going back to school, they don't need that, quote, college experience of living on campus and so forth. But once again, you have to look at all the components and how things work for you, the cost, accreditation, your family life, better to be in motion and going back to school, even if it's a slow process. So I commend you for that.